Hi, I'm Dr. Casey Benton, a cardiologist at Virginia Heart. My goal is to empower my patients to understand their heart disease and help them live a longer and healthier life. The main symptoms of cardiovascular disease include chest pain or pressure, shortness of breath, irregular heartbeats, dizziness or fainting. Once diagnosed by your cardiologist, there are 4 symptoms we want you to be aware of. Chest pain is the first symptom to look out for, and this includes any sort of pressure, burning, squeezing, tightness, or heaviness. Oftentimes, these symptoms are common for both heart disease and gastrointestinal issues. However, if you are experiencing worsening chest pains during exertion with relief by rest, it may be linked to cardiovascular disease. But if the chest pain is relieved by antacids, it may be linked to gastrointestinal illnesses. The second symptom to be aware of is shortness of breath. It is normal for us to get more out of breath with aging or when we are not in the best physical shape. But if you experience an abrupt drop-off in tolerance for activities that you otherwise have had no issue doing before, then this could be a red flag that there is something going on with your heart. The third symptom to look out for is heart palpitations. The vast majority of palpitations are simply premature beats, which feel like your heart's skipping a beat, or a normal increase in heart rate due to situational stress. Palpitations that are abrupt and sustain a doubling or tripling of the heart rate for prolonged episodes are more concerning signals of cardiovascular disease. Your cardiologist will review how to tell the difference between benign palpitations and arrhythmias that we should address. The fourth symptom to watch out for is sudden fainting, otherwise known as syncope. In many cases, fainting can be benign, and the vast majority of cases are not heart-related. However, if you are fainting in addition to any other symptom that I've mentioned so far, then there is a chance it is linked to cardiovascular disease. Additionally, most benign fainting episodes are gradual, giving you a few seconds notice to brace your fall and protect your head and face. If you experience a fainting episode that is abrupt with no warning, contact your doctor immediately. It is important to know when to contact your cardiologist and when to seek emergency care. Our team is always here for you, and Virginia Heart physicians are available at all major hospitals across Northern Virginia. If you experience a sudden onset of chest pain or pressure, especially when accompanied by difficulty breathing, this is a medical emergency. These symptoms require immediate attention that cannot be provided over the phone and often cannot be managed in a doctor's office. In these situations, do not delay. Call 911 right away. At Virginia Heart, we provide comprehensive cardiovascular care, from prevention and diagnosis to advanced treatment. But the most important partner in your care is you. Knowing your symptoms, listening to your body, and speaking up when something doesn't feel right can make all of the difference. If you ever have questions or concerns, your Virginia Heart Care team is here to guide you every step of the way.